I will be doing is kind of walking you through this issue that has been the primary focus of my work over the last, 17, 18 years, which is the health and healthcare, the physical health of people with serious mental illness, really thinking about them as a health disparities population. I would say this problem can be summed up in a chart, and it's from a paper that was published in 1930. And pretty much most of what came through in this paper and an accompanying book by an epidemiologist from New York State are really the same issues that we're struggling with now. At greatly varying intervals in different countries and with different types of death rates, there is complete agreement upon the fact of the excessive rates of mortality among the insane. So really what he brought to this was a more rigorous, really trying to look this at more carefully, a larger sample, and carefully breaking it out by age and sex. So he goes on to speculate about the causes of excess mortality among psychiatric inpatients, and says, the high death rates of institutionalized insane may be attributed to the combined influence of physical and mental factors. There are also indirect effects due to the fact that mental disease causes irregularities in nutrition, injuries, and external influences. Another factor tending to increase the relative death rate of the insane is that of economic and social status. So as we'll talk about when we kind of start drilling down into some of the causes, these are really a lot of the same reasons, the problems that we're seeing today that are underlying the cause of excess mortality. So, very nice study here done, very rigorously conducted, beautifully graphed, days before Excel, by hand. What was the impact, nationally? Pretty much zero. What was the impact even in New York State? Department of Mental Hygiene, pretty much zero. I mean, these work, pretty much just went, onto a shelf, as so much of our research does.